Hey everyone, this is Lacey with the Your Lyme Matters podcast, and I'm very fortunate to be joined by Dr. Marie all the way from Ottawa, Ontario. And hello, welcome, I guess I'll say first off. Thank
Oh,
you.
thank you, Lacey. Honestly, it's such an honor to be here speaking to your community. I'm just so blessed that you asked me to come.
Thank you so much. Yeah, it worked out well, and I appreciate your enthusiasm to come and do this and share some pointers with the community. First off, why don't you give us a little briefing on what you do? I'll tell everyone she is an ND, so that's a naturopathic doctor, because she knows best. I'll let her fill you in what she does over there in Ottawa, Ontario.
Great, thank you. Yeah, so I'm a naturopathic doctor in Ontario, and I am the co-founder of BioHeal Ottawa, an integrative naturopathic chiropractic massage clinic. We have many modalities, including nutrition. We do a lot of FSM, frequency-specific microcurrent. We have saunas and foot baths and all that good stuff to help people heal. And we specialize in chronic Lyme disease, mold illness, pandas, PANS, long COVID, allergies actually are some of our other fun thing that we do that we're really successful with. And of course, everything autoimmune, because essentially there's a big sign that you walk into our office and it says we treat the cause, not a medical label. So MS has a cause, ALS has a cause, Sjogren's disease, lupus, whether it's an infection, a toxin, a combination of that. So really, it's everything under the sun. We like to treat puzzles. We like complex cases. Chronic complex illness is our jam, that's for sure. We love it.
That's actually a question when I see people in mainstream medical. I like to say, do you like solving problems and mysteries? And sometimes I get a good answer. They're like, oh, yeah. And I've had the most uncomfortable, nervous laughs. And I know where that appointment's probably going to go. I'm like, oh, no. So I appreciate that you said that. So you obviously see patients in Ottawa. Do you see patients outside of Ottawa as well?
So anywhere in Ontario. Yeah.
Okay,
I'm licensed
awesome.
in Ontario. Yes.
Perfect. So anyone in Ontario, and do you do a mix of virtual, or are you all in person?
No, we do virtual phone consults and in person. So
Awesome.
I think the pandemic has taught us some great things, but I always did that because I did see patients from far away.
And for you personally, how did you wind up in this area of work? Because it's a niche on 10,000 other niches. For the people listening, this is not an easy type of medicine. I'll just put that out there. So what brought you to it? Because you have to stay in love with this to it's a hard area of functional medicine and all that stuff combined. So
yeah, thank you. I think it starts as a personal story, as it does for most of us doctors working in this realm. For me, it was my beautiful niece, Mia, who got sick at the age of 9 years old. She ran outside, came back in 5 minutes later with a tick on her stomach, and we didn't know what to do. My sister pulled it out, but after that, we just sort of called it a day because we looked online, we called for information, and they said no rash, no mark, no symptoms, move on. And then that was June, and then suddenly Mia in January was complaining about her ballet shoes. And so my sister thought it's the ballet shoes. And so she was punching the ballet shoes out. And then Mia complained about ankle pain, knee pain, hip pain, and the story unfolds that 6 months later, we didn't put two and two together, a bite to the symptomology. And then that took me down the path of oh my gosh, I've got to learn. I don't know anything. I learned in school that Lyme was, caught by a deer tick, and that's about it. And that was one paragraph, and we moved on. And so I went to every conference possible to learn and to help, try to help heal her alongside with other doctors who were in the mix. And Mia is doing fantastic today. So it's all, it's not thanks to Mia, but in Mia's illness that I was able to find this passion within to be able to help heal her and now help heal so many others.
That is amazing. I'm so glad to hear she's doing better, and how that's what you need. You have to have some sort of push or passion or willingness to always learn, any of those things can kind of draw you in. So
absolutely. And then it followed up with my own children's tick bites that I never saw. Here I am, a Lyme litter doctor, never saw the tick that bit them, but lucky for me, they both had a rash. It was not a bullseye rash. It was a very, very peculiar rashes that I acted on. And my kids are doing well today. And then, of course, I got a tick bite in 2021, and that was a doozy of a bite. And I didn't follow the conventional guidelines of acute bite treatment because I still had symptoms after 5 weeks. So I'm glad I knew enough and was able to follow through with the appropriate treatment long enough to be feeling 100% better now. So.
And that's a question because I've been hearing there's slight additions to that 6-week protocol for a lot of people. I'm
Absolutely.
just ask you right now. We're on the topic, and we've discussed before. For those listening, we have furry family members nearby, so you may hear some of that, and they just want to talk to you as well. So Dr. Marie, typically, I believe iLads, and you could correct me, they have the 6-week recommendation of antibiotic, and they've developed that because of the replication cycle of the bacteria itself. It takes that long, and to catch the different stages of the Lyme pathogen. Not to forget that it's usually not just Lyme, it's Lyme and its buddies, it's co-pathogens. So this is something I've wondered about and wondered when we're doing this and after the 6 weeks, what next? And what next for perhaps the buddy pathogens? And I'll also quickly say for both of us here, we don't want this to be substituted for medical advice. Always see your trusted provider for your own safety. This is us speaking from our own knowledge and experiences here. We'll stamp that on everything. And Dr. Marie can add her disclaimer in there if she'd like.
Yes, no, absolutely. You know, this is my experience, but it's not going to be everybody's experience. But I think as a guideline, we treat until the patient is 100% better. And so whether that's 3 weeks, whether that's 4 weeks, whether that's 6 weeks or longer, we really want to treat the patient in front of us and not look at a textbook. And, you know, the truth is that in its early stages, Lyme can be eradicated completely. And so that's when it matters. That's when aggressive treatment matters. I'm a big fan of using for a fresh tick bite a combination of antibiotics with herbals, making sure that we're on a good multi-strain probiotic and that we're taking Saccharomyces boulardii to prevent difficile. Under my watch, I have never had a patient get C. difficile because of that protocol. Okay. I'll often add herbs for co-infections like Babesia or Bartonella or Anaplasma, which has become extremely endemic here in Quebec and Ontario. I say Quebec because, you know, I'm 15 minutes from the border. Yeah. So it's all encompassing. It's not just one thing and it's not just antibiotics, but I am a fan at the beginning of using antibiotics for a fresh tick bite. That's for sure.
Okay. Good to know. Yeah. And good for people to hear. And all the more importance to try to connect with a practitioner if you have that accessible to you to even connect and get more on that information, what you could do for the co-infections.
Yeah, exactly. And you know, just going back to my niece Nia, like in lieu of what you've just sort of talked about, that, you know, sometimes it's a little different guidelines. I mean, treating children is different as well. And just for the viewers out there, I was trained by Dr. Charles Ray Jones, who I think is arguably the best pediatric Lyme disease doctor in the world. He treated over 20,000 children. He passed away a few years ago, but he always said a child's immune system is so robust, they may not mount symptoms for, 6 months, a year, 2 years down the line. So waiting for symptoms is really obsolete. It's really doing disservice to our patient population because a child may not mount symptoms for many, 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 many months. And so that is where Mia fell through the cracks, is that we just didn't know better. We weren't educated as doctors. And I think when we know better, we do better. So to your point, not everything falls on to the conventional thoughts of what and guidelines of what we're used to, especially when we're talking about children.
Right. And I'm really glad you said that. That was on my list to ask you as well, is because you did mention something I've never learned before or heard before about the location of tick bites. And so from my experience, I always wondered, and people I speak to primarily adults, just the way it is. And a lot of them that have been bit in the head area, they have this severe neurological presentation, almost like the symptoms are just slightly different from someone that maybe got bit down lower, like on the foot, for example.
Yeah,
Um,
correct.
have you
Correct.
experienced or any trends that you've noticed in your practice?
Yeah, absolutely. That was something, a pearl that I learned from Dr. Charles Ray Jones. He always said a bite above the neck is much more serious than anywhere else on the body, and that needs to be treated aggressively. So a child with a tick bite on the head, the neck, anywhere in that nature, and that happens easily with these kids climbing on trees, right? We have areas in Ottawa where patients are just walking in the park with beautiful groves of trees above. Some of the ticks have fallen down. So yes, we're used to guiding ourselves with always check from the ankle up, but it is the truth that we often see tick bites on the head, and those need to be treated very, very seriously.
And I'm going to go ahead and call myself out right here, because one of my friends asked me that and I said it was a myth, but I actually sat down and discussed, my partner's from South Africa, and we discussed the nature of animals that go from ground to trees in different areas. I thought that people wearing hats, I thought primarily it's just from shrubs. But when I spoke to him, I started to wonder. I was like, wait, some of those animals are up and down a trees, birds, different species. So it's not impossible. So that's good for people to hear. And to my friend, I told that you wouldn't need to wear a hat. I take it back.
Always protect yourself. Yeah, it's number one, right? I mean, we got to protect ourselves first. Patients say, what should I do? Or is there a herb I can take? And always my first thought is protect yourself with clothing, insect spray, etc. Tuck your pants in your socks, wear light clothing, wear long sleeve, do tick checks, either strip down. Some of my patients carry the rollers at Costco and they just use those, and those are very, especially in endemic areas, and they shower and throw their clothes in the dryer right away just to ensure that. And then I'm not sure the weather is like for you, but this is a very warm fall for us, and we still haven't had frost on November 22nd. And so we're still getting tons of tick bites here, right? I mentioned I'm treating one after this call.
Yeah.
So, we really have to be diligent and protect. That is the number one thing. If you take away anything from today, please be vigilant. It can happen to anybody.
Okay.
And they're so small. Take a pen, put a dot on the page, and that's the size of a nymph. So I can't see that. So
my glasses, there's guarantee I'm not seeing that. And so I would imagine then even shrubs and leaves, if you're out in the backyard, I think sometimes people think that that's exempt, but unfortunately in the cool, I've heard they like to go under. Is that what you've heard as well?
That's right. My son was bitten in a leaf pile. Yeah, mountain biking. He just dropped his ankle into a leaf pile, and the bite was after that. So it breaks my heart that we can't tell our kids to jump in leaf piles, and that
we just shattered hearts of a bunch of little people. They're like, "What? I can't
listen."
throw it up."
I'm a naturopathic doctor. I live for the outdoors, but I still enjoy the outdoors. So I do want the viewers to know not to live in fear. It's going to be something we'll talk about, obstacles to cure today.
Okay, awesome.
Not to live in fear, because I still hike, I still mountain bike, but I protect myself. I'm vigilant with what I wear. I stay on trail though. I no longer do parkour and get my kids right deep in the forest, unfortunately, but I still enjoy the outdoors. So there's ways that we can still enjoy the outdoors, which I think is we can't live without sun. We can't live without fresh air. So I do want our listeners to know that completely what I'm advocating, but I'm advocating it with safety.
Okay, yeah, that makes sense. Because I'd imagine you can still, perhaps, if you're protected head to toe, maybe you can throw some leaves. But yeah, it's to each their own judgment, I guess, on that. But yeah.
Exactly.
Yeah, okay. Well, thank you very much for that. Now, I will loop into something, because this is something that's come up on my previous episodes with patients, actually, and the importance that the International Lyme Disease Association plays in all of this, and for practitioners and even for patients. I believe you've recently been to their conference. They have an annual conference. So thank you for doing that. And would you like to tell us a little bit about iLads? Because you trained under a predecessor, and I will say, even though it's a long time away, condolences and may he rest peacefully, and thanking him for passing his knowledge down, because that's what we need to be doing. So
that's what it's all about. Yeah.
Yeah.
So ILAD stands for the International Lyme and Associated Disease Society. I believe it started in the late 90s or early 2000s. Don't quote me. And its membership, I think now is up to 650 members. 100 of those are naturopathic doctors, I just found out, which is great. But it's an annual conference. It happens annually in the US and once a year as well in Europe. And it brings a variety of speakers in a 4-day conference to learn and be able to move and push research forward, clinical experience forward, clinical pearls forward, so that we can all help better our patients. It's a conference I really love to go to and really look forward to. I learn so many little tips every year. It's just wonderful.
I'm so glad that it exists, and I would, in my dream world, I would love if every practitioner goes and gets involved with them. That would be my dream.
Absolutely.
So.
Absolutely.
Yeah. In the past on our podcast, we've said that could potentially be, that's a lot of recent research, that's based on research, that's science,
Correct.
That's medical journals, that's journals that are used in naturopathic medicine. It's a mix of all of those things. So
Correct.
It's the source for a lot of up-to-date knowledge, and to advance and keep up with the current times, which in these illnesses is hard. If you gotta keep up with them if you can, for sure, right?
Absolutely. Absolutely. Yeah. And I think the more educated we are, the better we are as doctors. What makes a good doctor is a doctor who is curious, of course, a doctor who has a good bedside manner, and a doctor who is open-minded to new thoughts, new patterns, and new research, and who always is intrigued and is wanting to learn. I think that being a forever learner is the most important thing. So really stay clear of a doctor who thinks they know everything, because we don't. We are always in learning, and I learn so much from all of you. I learn so much from my patients. It's because of you, I always tell my patients we're a team. Right? Like, it's not me guiding, it's all of us. It's me, your partner who's supporting you. I'm just the guide sort of nudging you in the right direction, but you're doing the work and you're as much of a part of it.
And those are all really good qualities, I think, that a practitioner could have, for sure. Curious, good bedside manner, respectful, open-minded. That's huge. Because as we in the patient world know, we go with something and they just shut it down, and we get shut down all day, every day by everybody around us with these things. That's the last place we want to be getting shut down. So super, super important. And I also heard you say in there, somebody who says they know exactly what to do. As long as you follow exactly what they say, you will get better. That's a red flag.
Totally. And like, what I commonly say to my patients is that I will never override you.
Okay, yeah.
You are calling the shots. So I may say to increase by 1 drop twice a day until you get to 15 drops. But if you get to 3 drops and it doesn't feel good, or it feels good and you just get an inkling to stay there because you're doing so well, then please do so. So that I will never be upset about. You are calling the shots. And I think the more I can empower my patients, especially patients who are mostly told that there's nothing wrong with them, that doctor is God, that I call the shots, that I'm the boss, that just doesn't work. So the more we can empower our patients, the more healing begins, because we can't heal in a sympathetic environment. We can't heal under stress. Right. And so the more that we're in charge of our own health, that we are in the driver's seat, and that I am the guide, that's the way to heal.
Yeah. And then also, if you put that into healthcare, where I've learned this, I know I'm telling you who doesn't know kind of approach. And sometimes it is the person doesn't know, but as you said, it damages the rapport and the healing going forward. I heard you mention in there also the word sympathetic. I'll let Dr. Marie add in there if she wants to let you guys know what the sympathetic nervous system means in all of this, because I think we'll talk about that eventually anyhow. So
sympathetic dominance is basically fight or flight, right? It's like running away from the tiger, the dinosaur, whatever is coming your way. Paper tigers, hours, a student under stress. So it's a stress response. And that is good because it shunts blood to your arms and legs so that you can run. Right? We need that.
Yeah.
You are in danger. You need to activate that sympathetic nervous system. However, it is not a place where you actually end up healing. The parasympathetic nervous system is the opposite, which helps you, if you will, rest and digest. So that's when we're sitting down, eating a nice dinner, and we are shunting our blood to our abdomen, to our heart, our vital organs, so that we can actually heal. And if we are screaming at each other during dinner in a sympathetic dominant state, we are not going to be shunting blood to our digestion, and we are not going to digest our food. We are going to end up with digestive issues, IBS, reflux, etc. So to my point, the secretion of cortisol does feed the infections. The infections love epinephrine and cortisol. Okay. So in that sympathetic dominant state where you get that release of cortisol and epinephrine, it just fuels the fire for these infections. So people often say, I'm always worse during stress, right?
Yes.
So my point to them is, once you get rid of the underlying infections, we all have stress. Mm-hmm. But when we get rid of the underlying infections, you will not have such a huge relapse as you stress. I get stressed, you get stressed. We all have some degree of stress, but it's a matter of having that stress come to a resolution. I heard a great speaker at the IMMH conference, the mental health conference in Washington in October that I attended. And she said something absolutely beautiful. She said, we as practitioners are always trying to get our patients to manage the stress, manage this, manage that, meditate, Mm-hmm. And that trauma can actually be episodic. It can just be constantly coming into work with a boss who you really dislike, who's quite passive aggressive. That is a minor trauma that you're experiencing daily. If you're constantly in this stressful environment and you're always under stress, it never comes down, then you never get a resolution. And so back in the day, the Paleolithic times, you used to run away from the lion. And then what did you do? You sat at the campfire and you relaxed at the campfire, right? Yeah. Mm-hmm. And so really that ability to actually deeply relax. And so, yes, I'm under stress, but now I'm going to sit on the floor and play with my dog or my kids. And now when I'm doing that, I'm going to be fully present. I'm not going to be thinking about the assignment due the next day or the workload that I have on my plate, really allowing that nervous system to come down. And I think that's really, really important, especially when we're chronically ill, because it takes the feeling of, okay, I can't be stressed. No, it's okay to have some stress, but you need to have a resolution to it and not, I call them cortisol junkies, always wanting the next, it's like, I finished that, I want more stress. It's subconscious. Mm-hmm. It's not that they're aiming for that. It's just that they are constantly living in this sympathetic dominant state.
Is there something, if you stay in that sympathetic too long? I've heard that sometimes, even in myself, it can sort of crash at some point. I don't know.
It'll burn out your adrenal glands that sit on top of your kidneys. It'll stop secreting cortisol and epinephrine eventually. That'll cause deep fatigue. There's a triad with the thyroid gland, the pineal gland. It'll burn out your thyroid gland. So often under stress, people kind of go, I was diagnosed with a thyroid disorder or what have you, or hypothyroidism or hyperthyroidism. So it's constant. We constantly see a huge episode of stress or a constant episode of stress. And then the body says no, right? Like Gabor Mate said.
It makes me really happy to hear the medical holistic for what I've experienced, because I've identified recently, even a flare up of symptoms for me is a traumatic episode in recent times. And I couldn't quite put a finger on it. What is going on? It's like, do I need 24/7 EMDR here? But it's just a constant. And I've heard people use, to complement what you've said, Dr. Marie, is a jar of marbles. And you fill it up. You adverse childhood events. That's a assessment for early childhood trauma. That puts your marbles closer to this line here. And basically, any little tiny thing at that point spills it over if for a visual representation of it. So thank you so much for pointing that out. And you're going to be providing validation to many people because they may not even have access to a mental health therapist or a clinician yet, and they may think it's all on them. Everything is, and that itself, you can spend therapy for years kind of learning that stuff. And so you did mention trauma. Now, do you have some go-tos that you like to suggest to people?
Yes, this is one of the obstacles to cure. So I have several obstacles where I see patients sort of stuck, right? A patient has been under treatment with a certain practitioner. They're 80% better, but they're stuck in some way. Sometimes for some people, it's the mindset and the limbic system and the vagus nerve or this trauma piece. I am not a psychotherapist and I don't begin to delve that way. I can give sound advice, but I do refer out.
Can I pause you for 1 minute? What you just did there is important. You acknowledge that something is a slightly not your area of expertise. That is something in general you want to see your practitioners doing. When I see it, I call it out in a positive way. So I'm going to unpause you. I'm going to unpause you now. I'm sorry if I made you lose your train of thought. I always lose my own.
No, you didn't.
Okay,
no,
good.
It's all good.
Glad you have yours.
I got you.
Yes, please carry on.
Yeah. And so there is no perfect program or therapy out there. You mentioned EMDR, there's brain spotting, there's cognitive behavioral therapy as a classic. There's so many out there. I will tell you, most of my patients have already gone that realm and they're still unwell. And that's because the limbic system gets damaged. So that's one of the obstacles to cure that we notice with a lot of our Lyme patients or complex chronic illness patients. The limbic system is part of the midbrain in the amygdala, and it governs threat or non-threat. So that's the easiest way to remember it. Okay. So is something threatening? Is there a lion or there's no lion? There's ice cream or something calming that you love. Okay. Yeah. And when you've been chronically ill and chronically trying to, get your head above water and chronically feeling sick, that damages the limbic system itself. Okay. So the body comes to think, I'm always in threat. Oh my gosh, I'm going to get sick. And the body starts to actually unveil more and more symptoms. So the best example I can give you is this. Let's say your practitioner brings to your attention that when you were a child, you were living in a moldy house and you go, oh my God, you're right. There was mold coming off the ceilings. I was always sick. I felt unwell since that day. And that house is white. Okay. The color of that house is white. Mm-hmm. You get invited to a dinner party the next week and it's a new friend. She says, come to my house. And you walk to the front steps and you notice the house is white and you haven't even stepped in the doors. And you start to have heart palpitations. You start to feel nauseous. You start to feel vibrations down your spine, electrical shock sensations, all of these symptoms of mold illness. And you're saying to yourself, what the heck is wrong with you? Mm-hmm. Like this house looks happy and clean. And when you walk in and your partner's going, honey, it's fine. But that's okay because your brain has already gone there. It believes it sees the color, and now the sympathetic state has governed and the limbic system has basically gone rogue. So another example is if I ask you, Lacey, right now, I want you to bite into a lemon.
Okay. Yeah.
I know you're trying hard like me, but I am salivating right now, right? Just asking you to bite into a lemon.
Yeah.
The brain is so powerful.
Yeah.
So it's not that our patients are making up these symptoms. No way. I don't believe that. But it's just that the brain is perceiving things as a threat. And so different programs that are out there can really help to calm the limbic system. Mm-hmm. There is DNRS, Dynamic Neural Retraining System by Annie Hopper. There's Joe Dispenza meditations. There's Gupta program. But my all-time favorite one is Primal Trust.
I had a feeling you were going to say that one.
Yeah, it is. You get tons of support as a patient. There's group involvement. Kathleen King, who is the founder, was sick herself, went practitioner, couldn't take one supplement. She'd react to everything. And so she used all of her knowledge through being sick and designed this wonderful program. And I've had so many patients heal from this, from limbic system retraining program called Primal Trust. So look it up. It's
Good
fantastic.
to know. Yeah. Mm-hmm.
And then there's the vagus nerve. So the vagus nerve runs sort of parallel with the limbic system. The vagus nerve is one of our cranial nerves, and it governs all of our organs, our, primary vital organs, our heart, our lungs, our digestive tract, from our mouth to our anus. And if it is dysfunctional, if it has been sort of damaged, if you will, or vagal nerve damage from trauma, from being sick for so long, from being dismissed, the vagus nerve is going to affect a patient tremendously. And so the difference with the vagus nerve symptom is that I'll notice that these patients startle easily, right? So they'll go I came to a waiting room last week for a patient, and I was just greeting her to say hello. Now, remember, she's in a busy clinic.
Mm-hmm.
She's in the waiting room. There's people walking by. She's watching. She's got her eyes open.
Mm-hmm.
I say, hello, ma'am. Nice to meet you. And she goes,
yeah.
And that was it. And I walked her into the room and sort of explained that to her. And she was like, oh, fascinating. I can't believe you picked that up from me right away.
Yeah.
She goes, Dr. Marie, I startle at everything. I'm just I'm shattering constantly because I startle all the time. People who have a gag reflex that's just, they choke on things. That's because their vagus nerve is not functioning very well.
Okay.
There's lots of exercises you can do for it, but truly the one therapy that we found to be really incredible for this is frequency specific microcurrent, FSM.
Okay.
So you can go on the website, fsm.com or frequencyspecificmicrocurrent.com, and find a practitioner in your area by locating your zip code or postal code, and you will be able to access that. But it has been an actual game changer, and on top for concussions and so many nerve pains and so many other things. But definitely for healing the vagus nerve, that's a go-to.
Okay, good to know. Yeah, I haven't even looked into that much, but I'm assuming from the name, it's putting out somehow different frequencies that are specific to different illnesses or areas.
So they are microcurrent, and the current is lighter than a 10s cam, but what it does is it increases the ATP production in your cells by 500%. It is extremely healing. And
that's good to know.
Very beneficial for multitude of injuries as well as concussions. It treated my concussion. I tried everything in the world to treat my concussion, but FSM was the winner. And I'm so grateful that I had access to it.
Awesome. And if someone, for whatever reason, might not have access, is there anything that comes to mind that they might be able to do just sitting by themselves? Or I know I hum. I've heard
humming
that helps.
is excellent. Gargling is excellent.
Okay.
Chanting in the car or singing, that all activates. You think about at the end of a yoga class, why do we do
the deep, the vibration.
That's activating the vagus nerve. Yeah.
Okay.
Absolutely.
Awesome. That's good to know. When my partner hears, because when I do it, it makes my partner and my dog sleepy. So I'll look over and they'll both just be passed out when I hum. So now my boyfriend will probably request it every day.
Oh, I love it. I love it. You're healing. You're healing several people. That's great.
Yeah, with the humming. So I heard you mention brain retraining programs that people can try to get into. Yeah, the Joe Dispenza. Is that one? I'm not familiar with that one. Is that a program? A full program as well, or is that meditations?
Yes, programs, meditations. Yeah, meditations. Okay. Yeah. So some people really jive with that, and that can be very helpful.
I'll definitely look up more on the frequency specific microcurrent. I'm pretty curious about that.
Yeah.
In your practice, it sounds like you see children and adults. What would be some of the biggest differences between the presentations or treatment of either or?
Right. Yeah. Good question. So sometimes children aren't communicative enough. So we have to use some of their language. So is there an ouchie anywhere in your body is what I typically ask. I don't ask, is there pain? If I'm asking for anxiety, I'm going to ask, do you have knots in your stomach? Does it feel, icky over here, right?
Mhm.
And I'll look for if the child is a nail biter, etc. that way. Children are microdosed, right? So we don't use the same dosages with children. Children don't mount rashes right away like adults. Sometimes they do, but oftentimes they don't. And certainly symptoms don't happen right away. We want to treat them regardless. And we don't want to wait for it. We can do the tick testing. It's nice to still do that to see how infected was the tick. But I still am a fan of treat a tick bite no matter what.
Okay, and we come across exactly that quite often. Sure, some of the recommendations are you can just send the tick and you can just wait and monitor for symptoms until you get the result back. But what you're saying there, and you can again correct or add in, is that perhaps in kids sometimes it may be harder because the rashes might not show up soon enough to be able to make that symptom call on then starting antibiotics. Okay.
Correct. I'm still a fan of testing the tick because let's say you start Lyme and Bartonella treatment and then you find out that the tick actually has anaplasma as well. Then you can add that extra potential antibiotic, but most of the time I use a herb to cover that species. But there are often times where the tick testing comes back negative and the patient is presenting with symptoms. So again, I treat the patient in front of me and not a lab result. I don't hang my hat on a tick testing result. It's nice to have, and I absolutely advocate for it, but we don't need to have it in order to move forward. Let's say you do the panel and it comes up with like 6 infections, then maybe we might consider treating that patient for 6 weeks and not 4 weeks, right? So it also helps to determine whether we should follow through with longer treatment or not, depending on symptoms, of course, depending on the amount of infections that are at play.
Okay, so still
as you know, ticks are nature's dirty needle, right?
Yeah.
So it's Russian roulette. You and your luck, what you're going to get, right?
What about in terms of psychiatric or mental health presentation? Now, kids are not my expertise, so I'm going to just say that right now. However, do you see any trends with behavioral changes that parents might be able to say, hey, this seems like this is not their typical, just I'm a little bit nervous about something or withdrawn. What mental health presentations do you kind of see in kids, if any?
Yes, absolutely. So we'll see a lot of rage, a lot of aggression. And although that can be related to Clostridia, although that can be related to a strep infection in pandas, children, pediatric neuropsychiatric disorders associated with strep, in the vector-borne infections, we often see it related to Bartonella. So Bartonella causes the most amount of mental illness type symptoms with our patients. So rage, aggression, irritability, volatility. Dr. Charles Ray Jones, one thing is clear that I took away from him. He's always said, a child with a seizure, you always must rule out Bartonella, even an adult. But he was treating children. So Bartonella, rule out seizures for sure. It can be strep as well, but Bartonella. So Bartonella, I think, is the number one co-infection that causes a lot of mental health issues. Babesia will cause a lot of anxiety as well, but you won't see as much aggression, irritability, right? So sometimes we can diagnose people by just the way they talk to reception. You know in my heart that that's not who they really are. That's the infection. So yes, these infections really affect mental health for sure. And case in point, MMI mental illness conference was created because they found that infections were at the key in the heart of mental illness in a lot of cases. So depression, anxiety, personality disorders, etc. These can often be related to Lyme and co-infections.
I've also wondered the deeper root of trauma, for example, is addressed. What is left of the broader name of the diagnosis on top of that? So that's something I've been super curious about. And in what you're describing, infections also. Once the infection's removed, what's left? Do they even have a Maybe they do still, but maybe it's minor. Maybe actually a psychiatrist or specialist would pull the diagnosis away once they're treated, from what I've just heard you say.
We see that all the time. I mean, I had a case of a child with anorexia nervosa. It was caused by Lyme. Her eating disorder went away after.
Okay.
She yelled at me on our first appointment, and, she was sweet as pie on her third appointment. It wasn't
Yeah.
her. It
Yeah.
was after we treated the underlying infections. She was a completely different child. And I hear that all the time, of course, from my reception who's dealing with the patients, on the ground. They say, wow, like what a difference,
Yeah.
what a difference we're making.
And from this perspective over here, it feels like you're a totally different person, and you still have to go on day to day. You're not the same person. I'm pretty relaxed person usually, but I've found myself in those spots, and I'm ready to go. I'm just like, say something to me, I dare you,
Right.
basically. And talking to me here, you could tell that's not my typical. However, my partner's got to see that, and he's surprised. He's like, I never thought I'd see the day where I'd have to grab your shoulder and say, come on, let's walk away, type of thing. So it also validates that for people that, hey, if they're in the depths of the mental health, psychiatric struggles, now we're not making any diagnosis here. We're just saying perhaps it's something to talk to your practitioner.
To look at. And I just think it's so beautiful that you have that support at home. The patients that have support do better than those who don't. Being validated by their family. And I often ask, if possible, that their partners or family members or mom and dad be on the call if it's a virtual call, or come in person to meet me so that I can sort of do a deep dive in explaining what's going on. Because once the support is on hand, I can have the best protocol. I can have the best idea of how to treat and really do everything right. But if you are living in negativity, or living in fear, or living in an environment where healing can't begin because nobody believes you or thinks you're making it up, it's going to be near impossible to heal. So it's really beautiful I just love it. And I actually take the time to thank the supporter for being so supportive, and how much they don't think they realize what an impact that makes. But that's a huge obstacle, another obstacle that prevents patients from healing properly, no matter what they do, despite them all best efforts.
He's going to be happy when this one goes live, because he does watch them. So I for sure will. And I'll jump back to what you said there. The neglect, like what you said, it's like you put a plant, and I've had this big metaphor going on with a contest, how long I could keep leaves on the tree outside for the neighbors. It was like the Sahara Desert out there. So it took 50 attempts. And then eventually the attempts on the grass, they gave a few little leaves on the tree. So it's hard to grow in a not ideal environment, but it also is going to allow people to perhaps take this podcast to their partners that are not supportive and still gaslighting them. And you've given me an idea, is that, hey, maybe the practitioner needs to have a call with both of them if that's within their practice.
In fact, it's in the intake when they, I ask them not to come in with a watch. I ask them to do several things, come in with a notepad, be prepared, stay on time. Please, I actually say, please bring your family and partner, because most of my patients obviously have brain fog from these infections and illness. And so they can't remember everything. And so it's nice to have that second set of ears, but it's also nice for the supporter or whoever the family member is to hear it from, if you will, the horse's mouth, to hear from me, what is going on with their patients, to help with the validation. Even if they are supportive, it brings it to a next level when they can hear it from a doctor. Yeah. Right. So I actually encourage it. I'm not one of those doctors that says, no, nobody else can come. I'm like, the more the merrier, because the more everybody is on board, the more successful the patient becomes. Right. And at the end of the day, I'm in the business of getting people better. Yeah. That's my goal. Yeah. So it's not to my advantage to not have the support systems on hand, to not have all of those things on hand. So it's wonderful to see.
Practitioners don't want to have a track record of every patient coming to see them and taking 40 to 50 years to have any progression of healing going forward. No practitioner is really like, yes, 20,000, not one step of progress forward. So to
I'd be depressed. I mean, I think I finish my days at 6:30 at night, and I think I still have energy, because you mentioned when we opened this podcast that it's hard work, and it is a lot of time spent in figuring out these puzzles. But Lacey, let me tell you this. when my patients get better, it's like Christmas morning. I
Oh
mean,
my
there's
goodness, yeah.
nothing better in the world for me,
Yeah.
than Christmas morning when I hear them, saying how much better they're doing. It's just such a dopamine hit for me, I'm just like secreting dopamine. And it feels really good because that's what I want. I want patients to get better. That's all I care about. So it's not to my advantage to have a patient not get better, to dwindle for a while. I want a patient better and they tell 10 friends that they are better, right?
Exactly. I'll actually jump right into it. I think you mentioned that you're on a functional medicine type of advisory board. Did I get that right? Functional medicine.
So it's a wonderful conference. It's called the Forum for Integrative Medicine.
There we go.
Yeah. And so it's basically a conference that brings practitioners that are interested in healing complex chronic illness. So if you have a practitioner you're working with, please tell them to come to this conference. It's the best conference in the world. They will learn everything they need to know for sort of Monday morning, cutting edge information on all modalities, including mold, pandas. You were talking about deuterium and so many interesting things this year. It's in Austin, Texas on April 2nd to the 5th. It's for practitioners only, though. I would highly urge your practitioner to go. It's just wonderful. I learned so much.
So I'm familiar with the term functional medicine. Integrative, does that mean integrating every modality that's going to help a person?
Correct.
Okay. I'm assuming in integrative functional root cause probably is in there.
Correct.
Okay.
You're
awesome.
right.
Thank you for
which is what naturopathic doctors have been doing forever. But just want to say that. I love this functional medicine term, but I'm like, you mean treating the underlying cause?
Treating the actual
that's what we do.
The actual problem. Yeah.
Yeah.
Except for
so it's a way to designate a medical doctor versus a medical doctor who does functional medicine. But naturopathic doctors have been doing functional medicine since the eons. Yeah,
okay.
Absolutely. But the Forum for Integrative Medicine is really the key conference to learning and diving deep into all of the nuances, but important ones when it comes to complex chronic illness, whether that's mold, pandas, Lyme, Epstein-Barr, COVID, long COVID, all of it. So we talk about it all. And I call it my tribe. It's like a great group of truly committed, curious doctors who are we have a great time. We learn all together. We are so inclusive and we just want to push this movement forward. And,
right.
Yeah.
By the time you have symptoms, there's a whole cascade of other things that have happened. And some of the times, certain areas of medicine, they'll treat the symptom that shows up, but then it can kind of still keep happening if you don't dig a bit deeper. For Lyme and co-infection community, a lot of the times root causes are at the core. And actually, I'll let Dr. Marie add in terms of categories or terms that block Lyme healing. What comes to mind when I say that in terms of deep root causes? We said trauma now. We said Lyme and the co-infections. We've mentioned some viruses that might be affecting the immune system.
Yeah, I'd say there's so many. I'd say the number one I want to talk about would be mold toxicity. I guess the light bulb went out for me, years ago when 20% of my Lyme patients weren't getting better, no matter all my best efforts, no matter their best efforts, no matter what we did. And then I had a patient who came in with classic mold symptoms. I treated it and suddenly all her Lyme symptoms got better. And so I literally cold called all those other patients, got them back. And they said to me, nobody else has figured it out. So yes, I'm coming back. Thank you.
Okay. Yeah.
So, and they got better. So mold is critical to Lyme recovery because we cannot heal when the environment is not optimized. So if a patient is living in mold, there's no way we can get the Lyme better because mold is neurotoxic, nephrotoxic, immunotoxic, carcinogenic. I mean, it really composts you from the inside out. So it's multifaceted, multi-level. It governs all sort of systems, hormonal. It can affect digestion. It can affect heart. It can affect just like Lyme can. And we basically breathe it in. Mold secretes these spores and the spores secrete mycotoxins, which are gas, which you can't see or smell. So we don't hang our hat on, well, I don't smell mold. It's not musty, so there must not be it. There's more than meets the eye. So we really want to address the environment, make sure that our patients are not living in mold, whether that's getting a mycologist involved to test the house or using an ERMI test that they can use to test the house. But that's really imperative. Asking questions like, are you worse when the snow melts? Do you get sick at church?
Mm-hmm.
Do you constantly feel sinus infections? Have you been diagnosed with MCAS, right? With mast cell activation disorder. That's number one cause of mast cell issues are mold illness. Number 2, Bartonella. Number 3, all the other co-infections potentially.
Right.
But I always look at mold first. Mold can be the real stick in the mud. I'd say mold is honestly, is
the king kahuna, the big pin.
Exactly.
Yeah.
It's the big pin.
Mm-hmm.
And once you address that, then Lyme treatments can just sort of flow. And it's not that I don't interweave the treatments, but we must address the mold, because no matter what my best efforts are, if they are still living in mold, we will not get them better. Unfortunately, that's the hard truth. I used to think like, oh, I can't ask them to move and that's expensive, but I wasn't doing anybody any favors. And so we really want to take a hard look. So, and it's more than meets the eye. It can be a leak you didn't see. It can be under the sink. It doesn't have to be a massive flood in the basement. It could be a slow dripping faucet behind the tiles that's leaking into the drywall. And so those things are important to address, and asking the past homeowners where there are leaks, etc. So making sure that that is addressed is number one. And that's really a lot of missed times when I get referrals from other practitioners. Mold has been missed. Now, another key item that has been missed is biofilms.
Okay, biofilms. Yes. Okay.
Biofilms are mucopolysaccharide matrices. So think of them as a gummy glue. The infections sequester fats and carbohydrates to make a cocoon. Okay. So what does a cocoon do to a caterpillar? It protects it from the environment, right? So within this biofilm, many infections sequester, not just Lyme and co-infections, fungus, parasites, viruses, they all have fun together. And they can then communicate within these biofilms through a language called quorum sensing. And quorum sensing allows them to orchestrate a slew of toxic events and inflammatory events behind closed doors.
Okay.
And so that is what keeps people. So when the infection is in this biofilm, it prevents the immune system from attacking it. Antibiotics can't kill it. Herbs can't kill it. And so it actually can survive for months and decades. And then it will release the infections. Infections will come out to play when the host is at its worst. So the host is in stress. The host is eating junk food. The host, meaning the person, is not taking care of themselves or not taking treatment. The infections will come back out to play. And so that's what we call a relapse, right?
Okay.
And so really addressing these biofilms are key. And how we address these biofilms, many different treatments that we use. Some of them can be a type of glycerin monolaurate. We use different types of enzymes like lumbrokinase, nattokinase, serrapeptidase. We use Google as a herb because that can break down the fat, and so many more. But those are just a few to name when we're looking at biofilms. But biofilms and mold, I think, are the top 2 reasons as to why people fail to improve.
Okay.
That has been missed. So do make sure.
This is good for the people that have already had relapses, because that means that, hey, perhaps something like that was just missed in the first place.
That's right. Exactly. And I think it's, and of course, like, think about it this way. Can you imagine you went to see your practitioner and they addressed biofilms on day 1? I mean, I always tell my patients, you probably would never want to see me again.
Oh,
you're opening Pandora's box, right? So it's not the thing you do first. I really want to put a stamp on that. And to, to our viewers, please seek medical advice on this. Please do not do this yourself. You could put yourself in a little bit of trouble.
A whole lot
down the line.
Yeah,
exactly. It's down the line, maybe at 6 months, maybe at a year mark. I'm not sure. It really depends on the person. But at that point, and how do you know whether you're ready to address biofilms? Is when you are on the max dose of treatment of an antibiotic or the max dose of the herbals, where your doctor says, I've got you on max doses, you're taking everything and you're, 50%, 40%, 80% better, you're okay, but you're plateauing. You come back visit after visit and you go, same.
Yeah.
I'm no better.
Mm-hmm.
I'm no better.
Mm-hmm.
That tells you that you're ready to address the biofilms, as long as we know that the mold is not there and all these other issues. But definitely, if biofilms haven't been addressed, that's typically one of the keys that I find that are missed on a lot of treatment plans from other physicians. When a patient comes to me, I go, oh, this is easy. Did you do any biofilm busting at any point? No. Yeah. Okay. Well, let's jump in there as long as we've addressed everything else.
So those are super, super helpful pointers. And again, for multiple people listening, even practitioners that might pop in and say, oops. And this is the chance that you go just learn from that and then move forward. As you mentioned, you did with mold in your case. New learning, it's constant new learning. So mold, biofilms.
There's dental health. There's dental health, right? Yeah. So we want to make sure that you don't have root canals or that they might have to be addressed, right? That's a dead space for infections to just hang out there. We want to rule out cavitations. A cavitation is basically an infected bone. And so people can have a lot of neurological symptoms around the head, sometimes in the arms or legs, but it all stems to the mouth. The mouth is crucial. Dr. Roger Tenenbaum says that, 65% of our infections reside around our mouth. So it is really, oral hygiene is really, really important. And so making sure there's no abscesses, making sure that, what is a biofilm is plaque. That's a perfect example of a biofilm in nature, right? Another biofilm is the edge of the lake, where the lake meets the sand, and that film that gets created, or leaving a glass of water on the counter for 3 days and getting a film around. Yeah. That's a biofilm, right? Dental health is really important. I'd recommend seeing a biological dentist because they use what's called a 3D cone X-ray. And the 3D cone X-ray is a wonderful way to make sure that cavitations have been ruled out, because that's often a key issue. And so once that is seen, that can actually rule out that there is or is not a problem. But biological dentists, best way to find them is through the IAOMT website.org. Okay. So that's an organization for biological dentistry, and that's the best way to address that. But really, oral hygiene is a key one. And then the last one I'd say, there's so many, but the last one I'd like to talk about is really untreated co-infections.
Right. Okay.
So, what if you have addressed Lyme, but you haven't addressed Epstein-Barr virus, which we're seeing an uptick post-COVID, or Bartonella or Babesia or Anaplasma? Anaplasma starts with the worst flu I've ever had in my life. That is a key symptom picture.
Okay. Mm-hmm.
So you may want to go back and go, did we address? I just had a current patient, an old patient, come back to me after years, and she's been doing mold treatment, good on her, for years. And one of her key symptoms was night sweats. And I went, okay, well, good for you for treating the mold, but this is Babesia. And she was like, oh my God, it's not mold. And so I got her on treatment, and she called me a week later and said, Dr. Marie, you're a genius. I can't believe I waited years to come back to see you. Again, don't do this yourself. See a doctor who really knows what they're doing. It could save you so much time, so much money. To see a Lyme literate doctor, and ideally a naturopathic doctor, because I do feel they do treat the cause of, or a functional medicine doctor. But to my point, the co-infection was missed. Yes, the mold was addressed, it was, but the co-infection was missed. So really make sure that you've addressed all of those as well.
To add to what you're saying, film. So that's hopeful in many ways, actually. It's a bit of both. You hear it and you're just like, darn it. You'd probably be angry, but at the same time, have a path going forward. So it's
absolutely. And I hope that I've given the viewers a glimmer of hope, right? This is not a session to make everybody go, oh my God, this is wrong with me. This is wrong. There's so many things we haven't even delved into, the heavy metals and all of these things. But the point here is to bring to fruition and to bring to light that, okay, well, there's things I haven't checked off that maybe there's hope for me to still get better, as opposed to, well, I treated the Lyme and there we go. I guess I'm stuck this way. No, I don't believe that. I believe there's ways to trudge through that.
I'd love you to participate in some myth busting with me real quick here. So does it matter if your house is freshly built, nobody's lived in it, and then you walk in? Is that a safe to say there's no mold here because it's newer?
Absolutely not. What we are finding now is that the mold is coming from the manufacturer on the drywall full of mold because it's been poorly stored at the manufacturer base. So there are houses being built so quickly that plumbing issues are happening right at the beginning. So I have a patient, their whole family is very sick with mold illness, and the house is only a year old.
Okay, thank you. I have a theme of anti-gaslighting as well, and a lot of patients get gaslit about this, and still today. And you've got something there on your tongue. I will say a builder told me a pipe blew up in a house and they didn't properly remediate it, and they built it anyways. So
right.
That's right from the horse's mouth, like not in a rude way, but like as you said,
right,
directly from the person that built the house said that. So
exactly,
I'll let you
exactly.
Go there.
Well, I live in a really old house. It's 1920s, and so an old house can have mold. As long as that old house, though, has been properly remediated in the basement, and it's really quite a dry basement like mine is, then actually my husband and I laugh because there's little currents of air that go through my house, right? But there's proper ventilations. These new houses are built so tight just to be so energy efficient that creates moisture, and that's where we see a lot of mold growth. Whereas these old breezy houses can allow that ventilation and limit mold growth, right? And we know that plaster and lath has very little ability to grow mold there compared to drywall, and so it's not always, also to your point about myth busting, that an old house is moldy.
Exactly,
it depends. As long as there's not been a flood, etc., and that the foundation is intact, but it's not a be and an end all in either direction.
Okay, so next myth busting, I sometimes hit the top of my fake teeth thing. The next question is for the partner who's sitting there by the sick person saying, I feel fine, this is in your head. What would you say to them?
Yeah, good question. So our DNA is all different, right? So our ability to detoxify mold right from the get-go is going to be different from one individual to another. I have families that have been exposed to mold, and 4 people are sick, 2 are not. Why is that? There could be a degree of in the area of the house who had more exposure. That's true. It could be a circumference. So I have a child that just came in yesterday that is 3 years old and is living in that moldy room with mom and dad, but that child's body mass is much smaller. So the same mold exposure is going to affect that person differently. And then the host, right? Are those family members that are not sick, not dealing with Lyme as well? If you're dealing with Lyme, you're going to react a lot worse to the mold. The mold puts the Lyme under threat. And so it absolutely widely is different member to member. And then that makes it difficult because one partner says there's nothing wrong with the house. The other one says, I can't put my finger on it, but I'm sick every time I'm here, right?
Yeah.
So that does become a difficulty. And that's where I urge that we do testing, both either blood, urine on the patient and or an ERMI test or a mycologist. We bring that in.
Okay, awesome. Yeah. So testing, getting professionals involved, and did you say
a mycologist? Like somebody that you would trust.
Marie, I'm going to jump back a little bit here. Something we did talk about. We talked about brain retraining and limbic system retraining. This wouldn't be a specific medical advice, but sort of to have some conversation around it here.
So I just think if the patient is not looking too overwhelmed at their first appointment, I will bring it up. And if the patient has a lot lot of fears around treatments right away. I often say we may be better off starting with limbic system training rather than starting on supplements, especially if a patient has apprehensions. I react to everything. I don't do well. Every practitioner before you has hurt me. Then I think they're going to do much better. The best way, I love the way Kathleen King explains this. She says this. She says, once you can calm down the nervous system and bring the patient back into a parasympathetic rest and digest state and not in this fight or flight cortisol epinephrine state, then suddenly the body is humming at a calm state. And then suddenly the immune system can actually see through without all the cortisol and can actually go, there's the Lyme. Okay, target. There's the strep. Okay, target. Oh, there's the fungus. Okay, target. And so suddenly the immune system can actually do what it was meant to do. I always say my goal is to help the body self-heal and auto-regulate. And so calming down the nervous system has that incredible ability to do so. We see that time and time again. If you've got mold falling off your ceiling and you can't breathe and you've got asthma constantly, sure, it's going to be a little hard to do some limbic system retraining. Yeah. Living in mold, I'm always an advocate of getting out of mold. That's 100%. But I do feel like at any point, all of my patients do so well with some sort of mindset, limbic training. So it's a very good question.
Thanks.
But sometimes people are too overwhelmed and sometimes people aren't ready for it. They have this conventional mentality that the drug will cure me, that the supplement is the cure. And that I can't heal myself and that I must rely on something outward. And it's an art as much as it is a science, right? I always say that. And so I have the ability of knowing when and what timing is right for each patient.
Yeah.
And I carefully curate that. And I think there's an importance to that. Yeah. And patients always tell me, how did you know that I was ready for it now? And like, why didn't you tell me this before? And I'm like, you weren't ready. And they're like, oh, you were right. I wasn't ready. I would have said you were a crazy person and I would have never come back. And so that's a little dance that I do. Mm-hmm. But if I find that there's a crack and I can get in there and mention to the patient about limbic system retraining, then it really does improve them much faster right at the onset. Yeah.
I would agree with you that it is an art. This is different than anything I've observed before. Watching, you can just see the wheels spinning in practitioners, even my own. And then they're even getting a flow sometimes when they're like walking around the room, and because there's so much experience, they can tell. They just know sometimes. So I would agree with you. It's an art form for sure. I've got a couple other questions for you. Just regards, we can take a peek at your website if people are trying to find you, if they're in Ottawa in need of a practitioner with a lot of knowledge who is also involved with ILADs and takes a root cause approach. I believe I saw on your website that you also offer like I think it's a tick bite.
Yep. So it's called Tick Bite Ready, and it's a quick, it's about an hour and 15 minutes online course sort of that you do on your own. It's very inexpensive and it will help you treat a tick bite from A to Z. So I give diagnostics, treatments, prevention on what to do. And then with that information, you can go to your own doctor or at least book an appointment with us, but it won't take as long of an appointment because you've already done that course. I also have a group program called Lyme Bright Collective.
Yeah,
we're in the process of recording those sessions so that it will be available for those who just want to do the educational part of the program. So that will be available in the new year as well. So you can just send us an email if you're interested and we'll put you on the wait list for that.
Awesome. Okay. Thank you. With that being said, because I unfortunately can't keep people here all day and all night because it's a free mic, is there anything else you want to say before we end this podcast?
I just want to say that there's hope to get better. I always thank my patients for giving me their trust because I take that quite seriously. I really believe that there's hope for all of us to get better, and that if we look at a causal chain approach and we treat the underlying cause, whether that's infection, toxin triggered by a stressful event, that's the way to go. And once we unravel that, then we have hope to get better.
Yeah, thank you so much. Because this podcast, it's what I needed to get me through my next week of my own medical stuff. Thank you for being a guest on the Your Lyme Matters podcast, and have a good rest of your weekend.